678 678 5678 45678 345678 234567 1234567 Hi guys, welcome to Talk with Becky, where we unlock the minds of individuals one conversation at a time. On today's episode, my guys and I shall be looking at prenatal care, and I have with me a midwife to discuss this topic with. Please guys, join your hands together as I invite my guest, Rukky ABAMBA. Come on. Hi, Becky. How are you?
I'm fine.
Shake. So good to have you here. I'm super excited.
I'm excited.
That you found time to be here.
I'm shy, kind of.
You are? Thank you, not be shy. Why should you be shy? Don't be shy. So the topic is prenatal care. A lot of pregnant women do not know how to take care of themselves when they are in that stage.
Okay.
Yes.
Yeah.
So quickly talk to me about the key elements of effective prenatal care and why they are very essential. I know you're a midwife.
Yeah, I'm a
so
midwife.
please talk to us about that.
So before I start with the key elements, I just want to state what prenatal care actually is.
Okay.
So prenatal care is also known as antenatal care because that's the normal.
Oh, really?
Yes, antenatal care. So it's just the care given to pregnant women during delivery till birth of the child to ensure the safety of both the mother and the child, and to prevent any form of complications that may arise during the course of pregnancy. So that's just simply antenatal care, and this care is done by professionals, either midwives or obstetricians.
Okay.
So then for the key elements of
Prenatal
care or antenatal care, is just normally antenatal care was put in place because it's kind of like a preventive care given to women to reduce the rate of mortality and morbidity during pregnancy. That was why they put in place that antenatal care. So the key elements we have, first of all, identification of high-risk pregnancies. That's women who are at risk of developing complications during pregnancy. Then we have identification and management of high complications that may arise during the course of pregnancy. Complications like preeclampsia and eclampsia. Preeclampsia is just like a combination of high blood pressure with convulsion or fits.
That can be really bad.
very, very, very risky. Then we also have screening of let me say for disease and conditions like sexually transmitted infections such as syphilis, HIV and AIDS. Then we also have screening for cases of domestic violence and screening for stress that may occur during the course of pregnancy. Maybe you can be able to detect women who are stressed. Identify and treat previous conditions before pregnancy. So people might have probably allergy situations, or probably they might have some kind of inherited diseases like sickle cell anemia, and some of them can also have some kind of conditions like heart conditions or kidney conditions. So all these require
they're very necessary to actually want to check on them.
We need to know their previous medical history before this pregnancy so that we know how we're going to care for them during the antenatal sections. Another element put in place is normally there must surely be counseling. Okay, so there's counseling. Counsel not just the mother, you counsel the mother, counsel the father and the family at large to prepare them for birth and then delivery process that occurs during pregnancy. And then we also have I talked about screening, right?
Yeah, you mentioned screening.
I mentioned screening. Then we also do some kind of testing, like we test for blood glucose test, we do urine test, we do the plasma cellular volume test, which is PCV test, to know if the woman is going to be anemic or not. Then last key I'm going to talk about is administration of some kind of medications. Prophylactic treatments, like for malaria, they give them pyrimethamine to prevent the occurrence of malaria. Because it might be harmful to the child during pregnancy. And then we also give vitamins to help boost their immunity. We give vitamins like folic acid, we give vitamins like iron, and we give calcium. So these vitamins, they help a lot during pregnancy. And why are these elements put in place? What are their importance during pregnancy? The importance of these elements is that it helps to, like I said before, it's a preventive care. It helps to identify, to treat, and then to also manage complications that may arise during pregnancy. So it's just for the safety of both the mother and then the child. That's just
That's really very elaborate, like very detailed. Thank you for that.
Alright.
How frequently should prenatal visits occur, and what happens during these appointments? Because most women do not even care to go for their prenatal visits.
A lot of women are scared of attending antenatal care. First of all, because of maybe they're afraid of the population of women coming in, because a lot of women usually come for antenatal visits, okay?
Especially if it's in a public
a lot of women,
hospital,
but don't be scared of the size of women or the population of women you are seeing. The most important thing is that they are trying to be able to detect any abnormality that will arise during pregnancy. So we just want your safety. The first thing that should come to your mind when going for antenatal is that, okay, that these professionals are here to check if I'm safe throughout this pregnancy period or not. So how frequent can one visit during antenatal? For focused antenatal care, according to WHO, a pregnancy should have at least a minimum of 4 visits. Okay, so I'm going to give you a breakdown of how this visit works. For a pregnancy, gestational age, because gestational age is calculated in weeks. Okay. For gestational age that is less than 28 weeks, we give them an appointment date 4 weeks at 4 weeks interval. Then when it's 28 to like 32 weeks, we give them like 2 to 3 weeks interval for appointment. So they'll be coming to the hospital every 2 to 3 weeks. Then for 32 to 36 weeks pregnancy, we give them 2 weeks interval. Then for 36 to 40 weeks pregnancy, we give them 1 week interval. But this appointment can also differ for a situation whereby the woman is probably among the high risk pregnancy category. So the doctors or the obstetricians or the midwives will give them a particular appointment day. Yes, it's going to be different from someone who doesn't have any complication at all in pregnancy. So that's how the appointment goes. And then what happens during this appointment? For first time booking, we call it booking. So if you're coming to the hospital the first time for antenatal service, first of all, we do health education. Most hospitals, first of all, do health education. So we have either nutritionists coming in to give health talk, or midwives or doctor, depending on the topic. So after health education, we start the main process that happens during this antenatal care. So the main process is that we first of all take the biodata of the woman, which includes her name, her address, her age, her date of birth. Then we take her occupation, then her certification, that's her level of education. Then we also take details of the husband too, a few details like his employment status. Then we also take his name and then address too, and then his age. Then after collecting biodata, we go further to do vital sign check. Vital sign is just to check the general well-being of the body. We do blood pressure, check for the blood pressure, check the height, check for the weight. The height and weight is checked so that we can be able to ascertain the woman's body mass index. Okay, so we know if she's short of weight or more, if she has additional weight. So if she has additional weight, we give her an education on how to cut down her weight, because heavy weights obesity is not good in pregnancy.
Yeah. And a lot of women can actually eat.
Yes,
you can eat. Like my brother's wife. I'm sorry. My brother's wife was taking a lot of milk.
No, milk is very good. Yes, milk is good during pregnancy. It doesn't really add.
Okay.
Just that as long as her midwife or her obstetric doctor is not complaining of her weight,
okay,
then it's fine. Yes, it's fine. Then like I said before, we are going to do vital sign check: your blood pressure, your weight, your height, then blood glucose level. Then after vital sign check, there's also temperature too. Okay. Then after vital sign check, we are going to take history. We call it history taking. Under this history taking, we have medical history. Medical history is just like if she has any history of allergy, if she has any history of any medical condition, like probably she has kidney problems or liver problems or whatever. Then after asking her for medical history of such, then probably under medical history again, we have number of pregnancies she have had, if this is her first pregnancy or not, if she had had abortions before or not. Then after that, we are going to take down the history of her previous birth.
Okay.
If she have had previous pregnancies now. So we're going to take history of her previous birth. Then the birthing process, did she deliver these children vaginally or through cesarean sections? Then after medical history, we're going to go further to menstrual history. We're going to ask her last menstrual period. This last menstrual period will help us to be able to estimate her delivery date. Okay. Then after asking her for her last menstrual period, we're going to ask her the cycle of her length. Is it 21 days? Is it 28 days? Is it 30 days? Hence, so we know how like frequent her period comes. Then after menstrual history, we are going to go further to ask her details about surgical history. Has she had any surgery before now? Probably appendectomy or myomectomy or whatever surgery she have had before. Then after surgical history, we are going to do some little testing like urinary testing, blood testing. Urinary testing just to check if she has probably protein in her urine, because protein in urine is like a comma in medical field. Protein urine just is like a pointer to conditions like preeclampsia and eclampsia in pregnancy, not just protein in urine per se. Protein in urine accompanied with high blood pressure, okay, is like a pointer to conditions that can lead to preeclampsia and eclampsia in pregnancy. Then
what's preeclampsia again?
Preeclampsia is when there is a combination of fits, that's convulsion, accompanied with high blood pressure. That's preeclampsia. Then after asking her about her surgical history and doing the urinary test and the blood test, then we'll go further to do counseling. Then she go meet the midwife. Midwife give her some kind of counseling. Then before counseling, we do physical assessments. We assess her from head to toe to see if she's properly fed or not. We check for anemia. We check for goiter, check her neck region to see if there's any form of enlargement, because goiter should not even be like, it's kind of a problem in pregnancy too. Then we also check her legs, her feet to check for edema. After all those assessments, we check if she has any form of rash around any of her body parts.
Wow.
Or if she has any problem at all, maybe cracks of the lips or sore in her mouth, or any problem that's deviating from normal. Then after that, we'll give her tetanus toxoid if she has reached the particular weeks
of delivery.
No, if the particular week that they give tetanus toxoid, like 16 weeks, yes, they give them tetanus toxoid, is to prevent tetanus from happening during pregnancy. Then we also give prophylactic treatment like pyrimethamine, like I said, for malaria, depending on the woman's week, depending on the week that she came for booking too. Then after that, she's going to be giving vitamins, folic acid, calcium, and iron. Most of these women, they don't like taking their routine drugs. They don't like taking it. They usually hold it. But if you are watching this video and you are part of those women that used to hide theirs at the topmost top of their cupboard, stop it, because it's not good. You are risking not just yourself, you are risking your child from good development, because this food you are eating, they might not have the exact iron that your child needs to boost both his blood or her blood and also the bone. So you need this calcium, you need this folic acid, you need this, especially folic acid, because folic acid helps to prevent neural birth defects. Defects that you see someone that has an opening on the spinal cord, or the brain is opened, or so many defects that could occur during pregnancy. So folic acid helps to ensure that these defects is not there. Okay, so please take your folic acid, take your calcium, take any routine drugs that you are being given during your antenatal care. Take it as prescribed. Then after this routine drug is being given, counseling, after counseling, the woman goes. Then subsequent visits, they do all of this except blood testing. The only thing they do in the blood test, they don't do full blood, they just check for the PCV. But when the PCV is less than 34%, some book of thought that 3 to 34%, the person is classified under anemia, either mild to severe anemia, depending on the level of the PCV. So the person is going to be handed over to the obstetric doctor that would prescribe medications and give her advice.
Okay.
So
These are very in-depth
it's very in depth because it's a very long process. That's why a lot of women don't like going for antenatal because it's a long process.
And a lot of midwives too don't have the patience to actually go through all of that stages with the pregnant women.
Like me, for me,
you might be, but a lot of women in
a lot of
it can be so annoying.
I worked in different hospitals, both as a student. So I've seen most they always do this.
It's really very in-depth. I like it. They always do. They take time to go through all of these stages.
Midwives were very dedicated to our work because it deals with children and everybody likes children.
It's true. All right, Rukky. So, on a prenatal test, and how do they ensure maternal and fetal health?
So, common prenatal tests. First of all, we have blood tests.
Okay, just like I've talked about that. Yes,
I've talked about blood testing. I've talked about urine testing. Then malaria testing. So all these tests ensure that the woman is safe. She's free from complication. It's just to treat, to detect, and to prevent any form of complications that may arise during pregnancy. Okay. So these are what this test just does, and it also helps to exclude some kind of conditions like preeclampsia, eclampsia, anemia, diabetes in pregnancy, and so many other conditions that may arise during pregnancy.
So how can pregnant women manage morning sickness? That's another thing. Fatigue and then back pain effectively.
Okay, so morning sickness, majority of pregnant women always have morning sickness, and it occurs during the first to 14 weeks of pregnancy. Okay, so this morning sickness is just simply nausea and vomiting. You're having the urge to vomit. Okay, so first of all, the first advice I'm going to give is that you should be able to know what triggers your morning sickness. So people maybe smell of a particular food or deodorant or whatever. Then some people is the food that they eat. Probably too much spicy food. Spicy food is not good for someone who is experiencing morning sickness. Not just spicy food, even fatty food rich in fats is not good for people experiencing morning sickness. So you cut down fatty food, and then I encourage you to eat more of bland foods such as crackers, such as toast bread, such as banana. So all these are bland foods, so it doesn't make you feel the urge to vomit. And then also when you eat in large quantities, some people eat large quantities, like they have this maintenance of 3 times a day meal, so they eat a very large portion of rice or beans or whatever. So if you are prone to having morning sickness, I would advise that you slash that. You eat in bits instead of eating in large quantities. So you can be eating every 1 hour, maybe 1 serving spoon of rice every 1 hour or 2 hours. It helps to cut down the urge to vomit, because what really causes this nausea vomit is because of this hormone changes of the hormone, the growth of the baby, and so many other factors. This puts together pushes that woman to have the urge to vomit. You get? So when she slashes her food, it will help to reduce it a bit. Then another advice I'm going to give is that if you're having morning sickness, you should probably be doing like little exercises, like maybe when you just eat finish, you just gonna sit down. It's not very, maybe you can just do a little walk around, just walk around the compound. Okay, just do a lot of not a lot of activity, do mild activities that is suitable for a pregnant woman. And then also when you finish eating, don't just go and eat and lie down on the bed back. Okay, so once you eat, give yourself a resting time before lying down. on the bed.
How important is mental health in prenatal care, and what support is available for expectant mothers?
Okay, mental health is very, very important because the state of the mind determines how well the body is going to function. So when a woman is mentally stressed,
Okay.
if she's mentally stressed, you see that pregnancy is kind of like very difficult for her because she's experiencing stress. She's emotionally down. She's passing through a lot. So we don't want that in pregnancy. So we ensure that the state of mind of the woman, both physically, emotionally, financially, because you need finance when you are pregnant. Okay, is among the best preparedness and complication readiness scheme in pregnancy. So finance must be there. If a woman is worried that she don't have the money to buy baby things and all that things, you see her, she's thinking, she's even forgetting to eat. So the baby is not growing well because the mother is not eating, the mother is thinking. So whatever the mother is passing through, the baby is passing through it. So if you are very happy, your baby is going to be very happy. If you are very sad, your baby is going to be very sad. If you are very energetic, your baby is going to be energetic. So whatever is triggering your mental health from going down, I advise that you look for ways, possible ways, or you talk to someone. You can talk to your midwife, you can talk to your obstetrician, you can talk to whoever, you can gynecologist, whoever is handling you that, oh, I'm passing through this, I'm passing through that, I need help. And trust me, they're going to be of help in one way or the other. And then I also plead to families. Some people, is their families that is the problem. Okay, so maybe mother-in-law or father-in-law or their husband itself. So
Causing the stress on
yes,
them.
causing the stress on them. So I'm pleading on their behalf that please, we want you for them.
Oh, right, Rukky, that was a very great submission and very well detailed, I must say. So, before you leave, what words do you have to say to my viewers? Because you can actually, or we could even have pregnant women watching this episode.
Yeah, very true. So the first advice I want to give to every pregnant to be mother watching is that don't be scared of antenatal care. It's very, very important that you attend antenatal care. It's very, very important to ensure that you are safe and your child is safe. Okay, and it will enable the professionals to be able to detect any complication that might arise during the course of pregnancy. Then, if you have issues with back pain as a pregnant woman, it's a normal phenomenon that's going to occur. So don't be scared. The only thing I'm going to advise you is that there's some kind of habits that you should cut down. For example, lifting of loads. Some people lift loads with their waist instead of using their legs. I don't know how I'm going to explain it, but like you squat, then you use your feet to lift the load rather than bending down to lift the load. And then when you are carrying shopping bags or whatever you are carrying, make sure you are able to balance it on both hands. Okay, so that you don't have one part more heavier than the
other one.
And then you can also do some kind of exercise is very, very good during pregnancy. Exercise is very, very good during pregnancy, not serious exercise. They have pregnancy acceptable exercises that you can do, like walking. There's so many other exercises. You can check it on the internet.
Dancing.
Okay, dancing. Very, very important. Dancing is also good. Then you can also do massage, like sacral massage, and tell your husband to help you massage your waist, or you can go to the spa to do that. Right. So another advice I'm going to give those people, because we have people who are actually afraid of being pregnant. We call them tocophobic people. Sorry. Okay. They are afraid of the concept of pregnancy on its own, both the birthing process and being pregnant. So some people avoid pregnancy. Some people don't even want to give birth vaginally.
That's why they opt for surrogacy.
Yes. Not just surrogacy. Some of them just opt for cesarean section. If you ask them, they'll tell you because I'm afraid that I might die during pregnancy. So naturally, it was not the will of God for any woman to die during pregnancy. But complications arise because of the way the world is right now. So that's why antenatal care is very, very, very important. And then those families that stresses their pregnant women should please stop doing so. As a pregnant woman, they need all the support. Pregnant women need all the support they could get from their family, starting from their husbands. So please and please, you can assist your wife in doing some kind of things. You can give her advices. You can just that stage she needs to be pampered, because it's not easy to carry somebody else. You just imagine carrying something on your stomach for 9 complete months.
Not easy.
It's not just carrying it to carrying it with so many changes. You have hormonal change, you have systematic changes, you pain. So please and please, let's try and help these women. They need all the support that they can get.
All right.
During this.
Thank you very much, Rukky, for that detailed submission. I couldn't have asked for a better guest, a better midwife to downgrade and tear this topic.
I was actually
detailed
shy
like
though.
this. No, but you did amazing.
Yeah, thank
you. Did
you.
great.
I was camera shy.
No, you did amazing. Trust me when I say
Thank
that.
you.
It was
Thank
really
you
nice
so
having
much
you
for
here.
having me.
But before you go, Rukky, we have a ritual that we play here. Are you ready?
Okay, I'm ready.
So we have a list of games here.
I love
We're going
games.
to do really.
Yeah, I love games.
Okay, so
especially
let's
Candy Crush.
Candy Crush. People play that for it. Really? I guess you playing it.
People see they play and
Hey.
people.
So we're going to be playing the 1, 2, 3, 4, 5, 6, 7, 8 game.
TikTok trend.
Yeah, the
yeah, now,
TikTok
let's
trend.
start
So
now.
let me see
Yes,
how often you watch TikTok. So are you ready? 1, 2, go.
1, 2, 3, 4, 5, 6, 7, 8. 2, 3, 4, 5, 6, 7, 8. 3, 4, 5, 6, 7, 8. 4, 5, 6, 7, 8.
Rukky, no, don't put my hands now. I was ready. I enjoyed it. Start again.
1, 2, 3, 4, 5, 6, 7, 8. 2, 3, 4, 5, 6, 7, 8. 3, 4, 5, 6, 7, 8. 4, 5, 6, 7, 8. 5, 6, 7, 8. 7, 8. 8. 7, 8. 6, 7, 8. 5, 6, 7, 8. 4, 5, 6, 7, 8. 3, 4, 5, 6, 7, 8. 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8.
And we did what? We ate it. We ate. So truly, you've been on TikTok.
Yes, no. I'm a TikToker. Follow me on TikTok on all my Instagram page at RUH.
Midwife, we like TikTok. Midwife, we like TikTok.
No. I don't really like TikTok. I'm not obsessed with TikTok.
Yeah, so guys, we have come to the end of another insightful episode on Talk with Becky. First and foremost, I want to say a very huge thank you to my guest Rukky ABAMBA for accepting to be here.
I really appreciate it.
And to you, my viewers, thank you for being part of the community. If you enjoyed this episode, you know what to do. Run to my YouTube channel, share, comment, like, and most importantly, Rukky, help me tell these people, subscribe. And I will see you again in my next video. Bye for now.